Okay, so hello everyone. Let's start. Let's start with talking about today's session. Let's see who all have joined. Sorry guys, for this delay of a couple of minutes. I mean, not a couple of minutes, probably 10 minutes or so. I just entered the home and that's the delay. Okay, so I think Vikesh is in the process of joining and Pradyumna is here. Okay, hi Pradyumna. And if at all the Vikesh joins, yeah, that's fine. Okay, no issues. Okay, so the topic for today is what? The topic for today is management protocol for your penetrating thoracic trauma, sorry, abdominal trauma. Okay, so that's the kind of the topic for today. Just give. Okay, right. Now, like usual, what I would like is I would like to kind of make this particular session a bit interactive. So let me see who all do I have in order to kind of interact with. Has Vikesh already joined? Okay. Anyway, so Pradyumna, you are here. Can you just unmute yourself? Pradyumna? Okay. It would be great to have somebody who is able to interact with me. Okay, no issues. If at all there's nobody to interact, no issues. What I'll do is I'll just kind of cover this in that manner, like in the directional manner, but it would have been great in order to kind of interact with you guys. Okay. So Pradyumna, if at all you're willing to unmute, you can just unmute and we can have a word. That's fine. Otherwise, let's kind of start. Okay. So what you need to understand is, okay, so let me just give you a couple of scenarios. Okay. So what are the couple of scenarios which I'm going to give you? The first one is, let's assume that there is a patient after the trauma, penetrating trauma, and then the patient has come to you after a GSW. What is a GSW? This is basically the gun shot. Okay, so patient has basically come to you with a kind of a gunshot wound which has happened into the anterior abdomen. Okay, gunshot wound to the anterior abdomen. You examine this particular patient, and on the examination, you are able to look at the entry point, which is basically in the anterior abdomen, and you are also able to look at the exit point. Okay, so you're able to look at the exit point on the back as well, that the bullet has kind of left the body. You are able to kind of see that, right? And I'm telling you that the patient is completely hemodynamically stable. Okay, patient is completely hemodynamically stable. Okay, so understood. I'll repeat my question. Trauma, penetrating trauma patient coming to you after the GSW, that is a gunshot wound. The bullet basically entered through the anterior abdomen and it left from the posterior abdomen. And you're able to see at the entry point and the exit point and everything. On examination, the patient is completely hemodynamically stable. What is going to be your next step? So, Pradyumna, yeah, I asked, requested you to kind of unmute, but I think Shivam has kind of unmuted. So, Shivam, am I are you willing to talk? Shivam, please unmute yourself again. Please unmute, and we can have a word about this particular scenario. Would you like to interact with me over this? Okay, Shivam left. Okay, no issue. Okay, that's fine. So, guys, I mean, obviously, I'll be able to tell you the answers, not an issue, but it would have been great in order to kind of have your opinion, because this basically helps you inculcate your mind, and then you basically arise at a kind of a good kind of answers and all those particular stuff, right? Okay, no issues. So let's talk about Pradyumna. You're not willing to admit. Okay, that's fine. Okay, so I think the most like you might kind of get an answer. Let's see. I'm really waiting for somebody to interact with me. I think Vikesh has trying to join back again. Just give me 1 minute. If not, then obviously I'll kind of proceed with the session in the monologue manner, but that's not going to be very, very good. Okay, anyways. So I think there's some problem with the Prakesh's internet. He's trying to join, but he's not able to join. Anyways, forget about it. Okay, so if I would ask the students, they would say that, you know what, the patient is hemodynamically kind of stable. So let's get a CT scan of the abdomen. But that would not be a correct answer. CT scan of the abdomen, that would not be a correct answer. So the correct answer over here would be that you have to kind of take the patients for an exploratory laparoscopy. You understand my point? In this particular scenario, you have to take the patient from exploratory laparoscopy. Now, what makes me say this? Now, ideally, I would have given you a couple of more, like at least 3 or 4 clinical scenarios, and then I would have interacted with you, and then I would have tried to kind of listen to you over this particular stuff. But because there is nobody to interact at this point of time, so what I'll do is I'll just walk you through the kind of a management protocol for a penetrating abdominal trauma. So whenever you have a patient with a penetrating abdominal trauma. Okay, so whenever you have a patient with a penetrating abdominal trauma, the first thing what you have to do is, okay, you will look for the signs of peritonitis and everything. That's all fine. That's not a very, very big deal. But more importantly, what you're going to look for is whether the patient is hemodynamically stable or the patient is hemodynamically unstable. Okay, so you would look for whether the patient is hemodynamically unstable or the patient is hemodynamically stable. I actually really did not want it to kind of do in this particular manner, because I'm just trying to teach you the management protocol, which is basically given in your Sabiscan and your Schwartz and everything, right? But if I would have kind of given the clinical scenarios, that would have made much, much, much more sense. For that, obviously, I would need live students in order to kind of interact with. But okay, it's okay. Let's kind of cover it in this particular manner only. Okay, so whenever you have a patient with a penetrating abdominal trauma and the patients are hemodynamically unstable, what do you understand by the hemodynamically unstable? That is the systolic blood pressure of the patient is less than 90 millimeters of mercury. Okay, that is the systolic blood pressure of the patient is less than 90 millimeters of mercury. In this particular scenario, what you have to do is you have to take the patients for an exploratory laparotomy. Okay, no other investigation is needed. If at all the penetrating abdominal trauma and the patient is hemodynamically unstable, no other investigation needed. Straight away, you have to take the patients for a exploratory laparoscopy. Okay, I hope you have understood this point. Now, let's say if at all the patient is hemodynamically stable. Okay, so if at all the patient is hemodynamically stable, then what you're going to do? Okay, so if at all the patient is hemodynamically stable, then what you're going to do? Let me see if the Kishan is joining. Hello, hi Kishan. Can you please unmute yourself and we can have a word? Hello, hi Kishan. Okay, no issues. That's fine. Okay, so what you need to understand is that we're talking about the like this. Just give me a minute. Yes, Kishan. Hello. Can you please unmute yourself? I really wish to have a word with you. If you can, just unmute yourself. Okay. Even if no, it's absolutely fine. No issues at all. If at all you can, just unmute yourself. Okay, that's fine. No issues. Okay. Now let's continue. So here what we have is the patient hemodynamically unstable, no other investigation needed. Straight to take the patient for an exploratory laparotomy. Now coming to the penetrating abdominal trauma, if at all the patient is hemodynamically stable, then there are two things which can happen. Either the patient is having GSW, that is a gunshot wound, or the patients are basically having the stab wound. Okay. Now, if at all the patient is the one which is having the gunshot wound, in the gunshot wound, what you need to understand, it can either involve the anterior abdomen. Okay. So if at all there is a gunshot wound which is involving the anterior abdomen, then what is going to happen? The patients are supposed to kind of take into an exploratory laparotomy without any other investigation, even if the patient is hemodynamically stable. Okay. Now, this is what the clinical scenario which you need to understand over here. Okay. So trauma patient, gunshot wound,